So I want you all to imagine the last time you went to a doctor's office or you went to go see a specialist. You probably were met with having to fill out some paperwork, whether it's what's your name, how old are you, why are you here, do you have health insurance, yes or no, um, who can we bill it to, what's your contact info in case something goes wrong, right? And then after that process, you get to meet the doctor specialist and you do your thing for whatever amount of time. Usually it's pretty fast because they see a lot of people. And at the end, you're like at the front desk, you're like, hey, I need to come back in a few months. And they give you a piece of paper when to come back. And what are you met with as well? At that time, usually a bill, and it's pretty steep, right? All right, so I am going to talk about why we should have universal health care, specifically in America, one of the richest nations in the world, and a capitalist mentality nation where it's not working, and we've seen it clearly not work during this pandemic, especially where a lot of people are dying and they're just met with so many bills. And I think it should be free now, but it's still being met with bills, either if it's COVID or a pre-existing condition or something new comes up. They're always gifted with, here's your bill, you owe us money now. All right. Oh no, how do I, okay, there we go. So I want to start off by one way we can achieve universal health care, um, was in an article titled The Promise and Peril of Universal Healthcare by David Bloom and all other authors. They said that progress towards achieving universal healthcare will be aided by new technologies, a willingness to shift medical tasks, highly trained to appropriately well-trained personnel, a judicious, oh no, hold on, I'm sorry. It went all the way back. No. Okay. A judicious balance between the quantity and quality of healthcare services and resource allocation decisions that acknowledge the importance of public health interventions. What I took away from this quote was that, yes, there will be new technologies that arise as time progresses, which is inevitable. As we've seen from the 1940s and 2010s, a lot has changed in the progression of either healthcare or just societal thoughts, and with that comes a willingness to like accept it or refute it. And it's just like there's a standpoint there whether we want to accept it or not, and how we can take that away. In another article by Elizabeth, oh my god, I forgot to do something. All right, never mind. um, After saying how we can achieve universal health care, I am going to discuss the other 2 points of what I'm going to talk about. We're going to see some real life examples that people have had to experience from either having health insurance or not having health insurance, and what that has meant, either receiving adequate health insurance or not receiving it at all and putting their health at risk. And then we're going to talk about what the opposition says about why we should keep this health insurance industry as a profit versus being universal, one of the reasons. And then another article by Elizabeth Rothschild in the Stanford Medicine, How Industry Shifted from Protecting Patients to Seeking Profit. Long story short, in that article, it started stating that Blue Cross Blue Shield of Texas first started off as being a nonprofit that was supposed to be for charities and seeking the best possible health for people without any regard for money. They wanted to make it so that anyone from all over the nation, whether they were under Blue Shield, Blue Cross of any state, they would get the best health and best coverage at either no price or a very low price. And whatever profits they would make, they would put it back into the community. And starting in the 1990s, when a lot of health insurance started to become profitable, they started going to Wall Street, and that's when they started becoming profitable as a Blue Shield. And that's when they shifted from being a more charity-based type industry to more of, I need money so I can build other people and profit off myself. And as a quote that states here, itemizes the ills that have befallen healthcare, including opaque and inequitable pricing, preserve financial incentives and an ethos of putting profits before patients. And I think that's a very important key phrase, the profits before patients, because it's always about, let me make a quick buck before I help someone else instead. In one article, it states that at least 53.8 million adults under 65, they do have a pre-existing condition, but they're still uninsured, which leaves them which begs to differ the question, since they're uninsured, does that pose a risk to their health with their pre-existing condition? I want you all to think about that as we continue. And then this one, I found this kind of hard hitting because I've gone through this, and it was just like a mind-blowing thing where in an article by Michelle Andrews, despite insurance health plans refuse to medical claims related to suicide. In this article, a woman, I don't want to say her name just to keep it anonymous, she stated that she had attempted suicide before and she had to go to the hospital for 3 days. And at the end of that, her and her mom were gifted with a bill of over $7,000 for the 3 nights. And they had to go and refute that because the insurance did not want to pay it for it at all. And then there was a quote that said, or the one I put in, insurance are all over the place on suicide and how to deal with it. And they were defending it by saying, well, state law varies tremendously. And in that case, the daughter and the mom, they actually got it down to 2000, but I was still shocked to see that that was even like a thing to be like, hey, here's a bill for this thing that happened and my insurance doesn't want to pay for it. It's up to you now. Another part that also really shocked me was there's a lot of areas within health, like it's such a broad umbrella. There's like mental health insurance, there's um, reproductive health insurance, there's just so many insurance like health umbrellas or subcategories that fall under it. And there's suicide. There was one I read about. This one's about eating disorders, where it's at 14 million are affected with anorexia, bulimia, and binging disorders. And they said, as a healthcare professional, 96.7% of them believe that their patients with anorexia are putting their life at risk for either not having insurance, or if they do seek help, they are scared for that bill because it is a pricey and steepy one, and they don't want to put up with more of that financial burden. And in the opposition side, there was the conservative case for universal health care. One person wrote that lawmakers don't want to have universal health care in America because once people are given free health care, they'll abuse it by going on weird medical joyrides just because they can, or simply by giving themselves the chance to go to free doctor visits just to do that. And I was like, okay, well, that's kind of weird because I feel like that would be beneficial just to go be getting checked up anyways. Regardless, that was the opposition, that one of the reasons they were saying it. So in conclusion, I want to talk about what I talked about. Basically saying that we should have universal health care because the health insurance that we have right now is very profitable, and we see that it's damaging to all forms of health with like itemizing bills and profits over people. And one call to action I think we can all do is we can understand the differences between gender, because there is also where lots of different genders will go and seek healthcare and they're giving different treatments, different bills, different ways of treatment and medication. And it's just not fair. There should be equality all across and like transparency between a healthcare professional and a patient that is seeking your advice. We should also educate ourselves and others on healthcare, either through plans, or we should tackle that insurance however it's doing. And we should also help support our healthcare workers, because yes, they are helping us, but they are also human too, and they need help as well. That is all. Any questions?
Thank you for the awesome presentation. So I personally want to add on to something for call to action is we have to support some laws that are not passed on, but like at the same time we have to support those laws to like have a better um more diverse insurance plans that covers. Honestly, one of my scariest thing is that call 911, something happens. I don't want to see a bill that,
Mm,
I don't know. Honestly, that's one of the scariest things, just like calling 911. So I just wanted to add on to that. Thank you.
yeah.
I have a question too.
Yeah.
So I 100% agree with you though. Like I feel too, like, like there's so many other countries that they give their people health free healthcare. It's something that we should be given free, and the fact that we don't, we're like, what the hell? But this is kind of just a question. Not that I always see this question too, and let's see, maybe you could have the answer. But a lot of people say that the reason why we can't have free healthcare for everybody is because then the country would go broke, or how are we gonna have enough money or something like that. Like, what do you have to say about that? Or have you heard about anything like that?
I was reading a little article that they did state that if we did have health insurance, we would go down, but it was more like they would just bring out random or like bizarre reasoning behind it that didn't make sense. But for me personally, I feel like the reason we don't have it is not just because the reason that I gave where they're like, oh, people are gonna abuse it. I also think there's like different layers of it where it's like people don't want to give free healthcare because they're scared that they're gonna use it correctly, or that there's like still racism ingrained where it's like, hey, like if I give free healthcare to a white person and then I give healthcare to like a person of color, we're gonna have to like treat them equally. And I'm just like, why is there still that mentality? Because it's someone's life at risk, basically. And I'm just like, I don't understand why it's still profit over people. But I don't understand any reasoning behind, oh, we can't have it because there's not gonna be enough money when we've seen they like pump money out of nowhere for like industries and companies to save them out of nowhere, where it's like healthcare is like, yeah, you're like second best, I guess. That's just like my take though.
Yeah, I completely agree.
Yeah.
I have a question.
Yeah.
Did you come across in your research anything about countries that do have universal healthcare?
I I briefly read about some, but they were
Mm-hmm.
like mostly just like not defending of them, or like they would
Yeah.
critique them heavily because they would be like, well, look at the European countries. Like I think it was I think it was about Sweden where they do give health
Yes.
care for
I did
free.
hear about Sweden.
And then they
I
were
heard
like,
about Canada too,
yeah,
but
that one too.
yeah.
But they were just like more like, yeah, we shouldn't do that. We shouldn't be like them. We should be ourselves. Look at how bad their people are. Their taxes are weird. And I'm like, I don't understand where they got any of this information. But I was
Right.
reading a little bit. I can read more about it and then I'll reach out more.
Okay. Thank you.
Yeah. Okay. I'll stop it. Okay. Wait,